forgot, is to record these videos and then put them on my YouTube channel. So this one will also be available. So if there's something that you maybe were distracted and you didn't get to see all that was in the video, then you want to go back and look at it, then you can go there and do that. But just don't think you can do it today because it's probably going to take me a day or so to get it on there. So anyway, so that's what we're going to do. Today's training is really about parenting and caregiver support. Autumn Williams, and she's gonna, like I said, she's gonna do this training. She is gonna share with you why she put some of these videos together, because she also has a YouTube channel. And if you go to Autumn Williamson, you can see the videos that she has produced. And they're really good. Some others that we won't cover today, but she has on it, and she can tell you a little bit about those other videos that she's done. So that's what we're going to talk about today. Really, this training, like I said, was first developed to train school and community personnel on trauma and its effects on children. So Katrina did that a little bit in the beginning of her video, the very basic training video. You all have received a lot of training, I'm guessing, on trauma. So it was just kind of a refresher on that. But then how do you respond to children's behavior that have been affected by trauma? And that's another piece of this program. Thus, that's why we have the toolkit. Then the next piece is just how do you share these skills with parents and caregivers? And that's some of what we're doing today. This is just a itty bitty bitty, like suggestions on how you can do it. So because we go so virtual now, we realize that it's probably a good thing to give you some things that you can share with your parents and caregivers. Thus, that's why we have today's training. And then last, how are we going to assess these skills that we've learned? And then how do we continue to work either with more training or support groups? Because I think this might be what will evolve too from this. I know that Candace shared with me that Logan County has already reached out, I believe, to Beth Mullins. Is that correct, Candace? Shake your head. I think you're the one that, yes. She's already reached out to Beth Mullins and has already made a visit to her, and they've scheduled some additional, I think, training and connection with her. So that's what I'd like to see evolve from this. I'm really attempting to bring you some people into your profession, your professional life, your group, so that you can like network with them. I'm a big networker. If I'm not really an expert at many things, but what I do like to do is find out who are the experts, and then who can get us the trainings that we need and sharpen our skills and make us better at what we do. So that's what I like to do. So that's what all this is about. So if you have any questions, you can put it in the chat for me. I will be watching that. Autumn Williamson, she's my graduate assistant. She's going to start with her part now, and I'm going to let her tell you a little bit about why she developed these videos, how they evolved, and then you're going to see two of the videos. They're rather short videos. I think one is about 8 minutes and one's 14 minutes. She'll tell you about that. But I just want to give you a taste of some information that you can access to share with specifically parents, because and caregivers, because I am a firm believer that so many times we work with kids in the school system and then we send them home to those parents who they spend more time with than they do with us. and the parents are at a loss. They don't know what to do. But if we would just share a few things with them, maybe then together we could work as a team to really help these kids. So, Autumn, I think you can share your screen, and I'm going to turn it over to you. And if you have questions, please do that in the chat, and I'm going to mute myself.
Okay, hello. I'm Autumn Williamson, and I'm, as she said, a graduate student. I actually am in a program at Marshall called Time for K, and we just use mindfulness-based practices to deal with children that have been affected by trauma. And in that program, I've actually gotten to work with some parents, and I realized that there's a lack of information when it comes to um, trauma. They have been, for the most part, taught what trauma is and sometimes how it can be displayed in children, but they often don't know. Can you hear me now? Okay. I'm sorry. My internet connection is always terrible. But anyway, so parents are taught a little about this, maybe just the surface, if that, but not taught how to actually go from there or combat anything. And I just thought that it would be helpful to start a video kind of series for parents, and it teaches them about trauma, what to do next, and about support personnel or resources and advocacy that's available already for them. And Francis, honestly, it might would be more beneficial if you shared your screen and showed my videos. Do you think you could do that? Because I'm afraid mine will freeze in the middle.
Okay, I'll try that. Let me see. I don't have your videos up. I should have done that.
Just no, I didn't even think that my internet would mess up. So I'm sorry, everybody.
Okay. Well, I guess I can try. Hold on, Autumn. Let
Okay,
me
just
see.
from my
Okay.
YouTube channel.
Okay. Autumn knows what a novice I am at all this. And but I usually get there. It just takes me a minute to do this.
But the videos are very short, and I would like to think that they're pretty easy to listen to and easy to understand. And I made them with the parents as an audience in mind. So please give me feedback, give me comments, and I can revise as necessary. So it would be, let's see.
Which one do you want to do first? The guide for parent support. You really want to do the tool.
One moment.
See what other bit. Let me see if I can find all your. Okay, this is it. Right? Do you want to do the trauma one first?
Yes, please.
All right. You want me to go ahead and start it now? All right, we're going to start this video, and it is 14 minutes long. That's the one, Autumn? Okay.
Hello and welcome. This presentation is a part of the series, A Guide for Parents of Children in West Virginia Public Schools. Today's presentation focuses on children who have experienced trauma. The following information was collected from a handout from the Child Welfare Information Gateway website. The goal of this segment of the series is to help parents better recognize trauma and, in turn, help their children cope after trauma. Let's talk about what is actually meant when the word trauma is used. Trauma is an emotional response to an event that threatens or causes harm. The harm can be physical or emotional, real or perceived, and it can threaten the child or someone close to him or her. Trauma can be the result of a single event or it can result from exposure to multiple events over time. Examples of traumatic events include, but are not limited to, abuse, be it physical, sexual, or emotional, neglect, effects of poverty, such as homelessness or not having enough to eat, being separated from loved ones, bullying, witnessing harm to a loved one or pet, example, domestic or community violence, natural disasters or accidents, unpredictable parental behavior due to addiction or mental illness. Trauma can affect children's bodies by causing the inability to control physical responses to stress, and it can lead to chronic illness even into adulthood, such as heart disease or obesity. It can affect children's brains and thinking, causing difficulty thinking, learning, concentrating, and impaired memory. Trauma also causes difficulty switching from one thought or activity to another. Trauma can have a negative effect on emotions or feelings. It can cause low self esteem, the feeling of being unsafe, an inability to regulate emotions, a difficulty forming attachments to caregivers, trouble with developing and maintaining friendships, and trust issues and depression and anxiety. It can have an effect on behavior, including a lack of impulse control, fighting, aggression, running away, substance abuse, and or suicide. In many cases, a child's body and brain recover quickly from a potentially traumatic experience with no lasting harm. However, for other children, trauma interferes with normal development and can have long lasting effects. Factors that determine the impact of traumatic events include the following: age. Younger children are more vulnerable. Even infants and toddlers who are too young to talk about what happened can retain lasting sense memories of traumatic events that can affect their well being into adulthood. Frequency. Experiencing the same type of traumatic event multiple times or multiple types of traumatic events is more harmful than one single event. Relationships. Children with positive relationships with healthy caregivers are more likely to recover. Coping skills. Intelligence, physical health, and self esteem help children cope. Perception. How much danger the child thinks he or she is in, or the amount of fear the child feels at the time, is a significant factor. Sensitivity. Every child is different. Some are naturally more sensitive than others. The age of the child can often determine the symptoms they experience from trauma. Young children, ages 0 to 5, are known to experience irritability or fussiness, startling easy, or being difficult to calm, frequent tantrums, clinginess and reluctance to explore the world, a change in activity levels much higher or lower than that of their peers, repeating traumatic events over and over in dramatic play or conversation, and delays in reaching physical, language, or other milestones. School aged children, those aged 6 to 12, often show symptoms of trauma as difficulty paying attention, being quiet or withdrawn, frequent tears or sadness, talking often about scary feelings and ideas, difficulty transitioning from one activity to the next, fighting with peers or adults, changes in school performance, wanting to be left alone, eating much more or less than peers, getting into trouble at home or school, frequent headaches or stomach aches with no apparent cause, behaviors common to younger children, such as thumb sucking, bedwetting, or fear of the dark. Teenagers, or those aged 13 to 18, who have been exposed to trauma often experience talking about the trauma constantly or denying that it happened, refusal to follow rules or talking back frequently, being tired all the time, sleeping much more or much less than their peers, nightmares, risky behaviors, fighting, not wanting to spend time with friends, using drugs or alcohol, running away from home, or getting into trouble with the law. When faced with a trigger, depending on whether the child has a fight, flight, or freeze response, the child may appear to be throwing a tantrum, willfully not listening, or defying you. However, responses to triggers are best thought of as reflexes. They are not deliberate or planned. When children's bodies and brains are overwhelmed by a traumatic memory, they are not able to consider the consequences of their behavior or its effects on others. Now that you know what trauma is and the effect it can have, you may feel a little helpless. Do not worry. There are several ways you can help a child who has experienced trauma. The first important step is to identify the trauma triggers for your child. What distracts your child, makes them anxious, or results in a tantrum or outburst? Help your child avoid these triggering situations, at least until they have healed more. The second step is to be emotionally and physically available. Provide attention, comfort, and encouragement in ways your child will accept. Younger children may want extra hugs or cuddling. For older youth, this might just mean spending time together as a family. A third step is to respond rather than simply react. Your reactions may trigger a child who is already feeling overwhelmed. Some children are even uncomfortable being looked at directly for too long. When your child is upset, do what you can to keep calm. Lower your voice, acknowledge your child's feelings, and be reassuring and honest. The fourth step in helping a traumatized child is to avoid physical punishment. This may make a traumatized child's stress or feeling of panic even worse. Parents need to set reasonable and consistent limits and expectations and use praise for desirable behaviors. Praise and rewards for positive behavior can include hugs if the child is comfortable with this, high fives, saying, "Great job," attention, a trophy or badge, or extra time doing a favorite activity. Step 5 is to listen. Do not avoid difficult topics or uncomfortable conversations, but don't force children to talk before they are ready either. Let children know that it's normal to have many feelings after a traumatic experience. Take their reactions seriously, correct any misinformation about the traumatic event, and reassure them that what happened was not their fault. Step 6 is to help your child learn to relax. Encourage your child to practice slow breathing, listen to calming music, or say positive things such as, "I am safe now." Step 7 is to be consistent and predictable. Develop a regular routine for meals, playtime, and bedtime. Prepare your child in advance for changes or new experiences. Step 8, be patient. Everyone heals differently from trauma, and trust does not develop overnight. Respecting each child's own path of recovery is important. Step 9, allow some control. Reasonable, age-appropriate choices encourage a child's sense of having control of his or her own life. Step 10, encourage self-esteem. Positive experiences can help children recover from trauma and increase resilience, or the ability to bounce back from a negative experience. Examples include mastering a new skill, being part of a community group or cause, and setting and achieving goals, and helping others. If your child's symptoms still last more than a few weeks, or If they are getting worse rather than better, it is time to ask for professional help. Quick, effective mental and behavioral health interventions may help in the following ways. They can increase your child's feelings of safety, teach your child how to manage emotions, particularly when faced with trauma triggers, help your child develop a positive view of him or herself, give your child a greater sense of control over his or her own life, and improve your child's relationships with family members and others. A recent study finds that severe childhood trauma and stresses early in parents' lives are linked to higher rates of behavioral health problems in their own children. Also, learning about what your child experienced may even act as a trigger for you, especially if you have your own trauma history that is not fully healed. Being affected by someone else's trauma is sometimes called secondary trauma. There are physical, behavioral, emotional, and cognitive symptoms of secondary trauma. Physical symptoms include headaches, stomach problems, sleep problems, weight gain or loss, and lack of energy. Behavioral symptoms of secondary trauma can look like increased drinking or smoking, procrastination, feeling overly critical, and avoiding other people. Some common emotional symptoms are anxiety, frequent crying, irritability, loneliness, and depression. Cognitive symptoms of secondary trauma exposure are inability to concentrate, forgetfulness, loss of humor or fun, and the inability to make decisions. The best cure for secondary trauma is prevention. In order to take good care of your child, you must take good care of yourself. Here are some things you can do. Be honest about your expectations for your child and your relationship. Having realistic expectations about parenting a child with a history of trauma increases the chances for a healthy relationship. Celebrate small victories. Take note of the improvements your child has made. Don't take your child's difficulties personally. Your child's struggles are a result of the trauma he or she experienced. They are not a sign of your failure as a parent. Take care of yourself. Make time for things you enjoy doing that support your physical, emotional, and spiritual health. Focus on your own healing. If you have experienced trauma, it will be important for you to pursue your own healing separate from your child. Seek support. Your circle of support may include friends, family, and professional support if needed. Don't be afraid to ask about resources available from the child welfare system, such as a caseworker or support groups. Hopefully, in this presentation, you've learned some useful information to help your child and possibly yourself cope with a traumatic experience. The resources that were used in the creation of this presentation, along with some extra resources for learning more, are listed on this page. Thank you.
Okay, just a little follow-up from that. Does anybody want to say anything about what they saw or how that would be possibly good to use in with the parents that you work with? One thing that really stands out to me is that I think it's difficult as a professional to share something like that with, say, the parent of a child that has experienced trauma, because I think that parents sometimes may feel guilty about that, and that might, and maybe a little sensitive to it. But as I think about the grand families programs in particular, or even foster parents, I think it's a good support for them. Any comments? Anybody want to say anything about that?
I think it's Tara wrote in the chat.
Okay.
Thank you, Tara. I'm also going to put my email in the chat. So if anybody wants to give me private feedback or suggestions on how I can maybe, I don't revise it in any way. If you think it needs revised, just please let me know. I would appreciate it. I will take your constructive criticism. Um, but yeah, if nobody had any questions or anything, the next presentation, it actually deals with the types of support personnel in the school. And it's just in order to inform parents about that and who those people are and what they're useful for you. Well, for you as parents. So
Okay, I'm going to try this again and see if we can't get there. Well, let's see here. Well, that's not what
I
I'm.
think it's that one at the top left.
Right here. Okay.
Yeah.
Thank you, Autumn.
Hi, and welcome to this installment of the Guide for West Virginia Parents. Today we'll be focusing on support personnel. This presentation was created by Marshall University MSW grad student Autumn Williamson. If you are a parent and you're wondering who are all of the seemingly random individuals in your child's school, you may not be alone. You may have heard multiple titles thrown around lately, with budget developments bringing new professionals into the public school system. Although roles and responsibilities may differ among schools or counties, these people are there to help, protect, and advocate for your children. However, without much introduction into who they are and what they do, they can seem intimidating and confusing. Educating yourself on these professionals and their roles is important in building a connection with your school that can lead to a more positive and successful experience for your child or children. Let's start with the school counselor. A few common responsibilities of a school counselor are to help students with personal challenges adapt more to their surroundings and plan for academic success, administer and interpret achievement tests, interpret student records, scores, and credits, address issues such as conflicting class schedules, behavior modification, and even serious issues such as substance abuse. Support students to have the best overall experience at school. Small group counseling, large group developmental interventions, and vocational and career development, educate about age appropriate topics, and help all students in the areas of academic achievement, career development, and social and emotional development. Next on our list is the school social worker. A school social worker can deal with problems related to or caused by factors such as poverty, trauma, and disabilities, address social issues that affect a child's development and education, such as bullying or a lack of resources for school supplies, identify students at risk, provide early interventions, problem solving services to students, parents, school personnel, and community agencies, work to remedy barriers to learning created by poverty, inadequate healthcare, and neighborhood violence, and provide support to prevent truancy and dropping out of school. The school social worker's mission statement is to serve as the link between the home, school, and community in providing direct as well as indirect services to students, families, and school personnel to support students' academic and social success. Another support personnel role is the school psychologist. A school psychologist deals with identifying intensive mental health needs, psychological assessments and intervention strategies, individual behavior and personality and ability assessment, and organizational consultation, developing education plans that focus on mental health, referring or providing services for students with learning disabilities, emotional and behavioral problems, and those experiencing mental health problems. School psychologists help children, parents, teachers, and members of the community understand and resolve these concerns by helping students with learning problems, helping students cope with family and life stressors, and helping students with behavior problems learn new ways to respond. Next up, we have Communities in Schools, or CIS. A CIS site coordinator is expected to use yearly data to identify needs of the school as a whole and individual students, develop a plan to meet academic and non-academic needs, deliver tiers of support to school, students, and families, monitor student and school progress, adjusting services as needed, and conduct regular assessment of partners and student supports to demonstrate success and continually improve practice. Communities and schools build relationships that empower students to stay in school and succeed in life. Another helpful support personnel is the attendance director. An attendance director's role is to work with students and families to get to the bottom of unexcused absences and encourage faithful attendance, provide family support and resources for truancy prevention, work with principals and other staff to develop a better attendance program that begins with prevention, truancy prevention activities that support regular attendance and get rid of the need for other interventions for unexcused absences, conduct home and other off-site visits to address student attendance as well as other physical and social emotional needs, attend parent conferences, team meetings, SAT meetings, and other meetings related to school attendance or even non-attendance issues, determine and refer at-risk students, and participate in truancy and pre-diversion meetings, collaborate with other support personnel to connect at-risk students with prevention services, and lastly, make referrals to the judicial system for students with excessive absences. The mission of an attendance director is to advance student success and help close equity gaps by reducing chronic absence. Another support personnel role is the behavior interventionist. Counties may use different titles for behavior support personnel. The role of these behavior interventionists are to assess students with behavior issues and devise a behavior plan for the student, conduct functional behavior assessments or FBAs and behavior intervention plans or BIPs to check for behavior issues, change and update behavior support plans and behavior goals as needed, provide ongoing support and resources to educators for IEP or individual education program development, disability information, research-based instructional strategies, or behavior management. The next support personnel role is that of the school nurse. The school nurse can work with students providing first aid and care management, providing health education through individual and group sessions, promoting healthy habits and choices, and screening for health conditions. School nurses can also assist families in identifying and adapting to health and social stressors, obtaining care for identified health problems, and staying informed regarding health and wellness in youth and their family unit. These are all of the support personnel we will cover today. Next, I want you to answer a question to yourself. True or false? Is it just the school's responsibility to reach out and form a relationship with you as a parent? Don't worry if you don't know the answer. We'll discuss it in the next slide. The correct answer is false. Now, to go about correcting the myth. Most school personnel deal with at least one classroom full of students per day. While it is important to them to form a relationship with the parents of their students, it might get pushed to the bottom of their massive list of to-dos. There are no set rules when it comes to forming a relationship with your child's school, and something as simple as a phone call or meeting could be all it takes to find that connection. So reach out and contact your child's school. This will start to bridge the gap between your child's networks of support that can help them become more successful. Here are some ways you can reach out to your child's school. Introduce yourself as early as possible and provide information about you, your child, and their home life. Don't wait until there is a problem to address something with the school. Picking your child up from school at the end of the day is a great opportunity to meet some of the school staff. A phone call, Zoom call, or in-person meeting are usually more effective points of contact between you and your child's school than email or other written communication, unless told otherwise. Ask to be kept updated on your child and provide the appropriate school personnel with updates from your end. Lastly, offering your services or support through volunteer work is a great way to build a positive relationship with the school. I hope this presentation taught you a thing or two about who is available to help your child and your family and how to reach out to them. Thank you for watching.
Okay, so once again, if you have questions, comments, concerns, either put them in the
Welcome,
chat.
and thanks for joining me. Today, I will be presenting material I have
sorry.
compiled while reading a book I
We've been
thoroughly
through this
enjoyed called
before.
Hacking School Discipline: 9 Ways to Create a Culture of Empathy and Responsibility.
Okay, so just either put them in the chat or you can email me. And I'm not sure, like I said in the presentation, I'm not sure if you actually have all of those support personnel roles in your school, but I found the list and information on the West Virginia Education Department's website, and they actually have some nice informative like handouts and stuff on there. Well, digital handouts on there, and I kind of took most of my information from that. So yeah, if you have anything to add, I would love to hear it. And also, I was taking a little attendance sheet. So if anybody doesn't have like a name on your screen, do you care to type your name in the chat so that I can write you down? Please. Thank you so much.
Okay. All right. All right. So that's our resource that we have for, at least it's a small resource, but it's something I hope that you all can use. And I specifically thought about grand families and foster parents. Do you all that work with the grand families program, how do you think, is this something that would be helpful for you to share with, or if it's not exactly this, or have you shared anything similar to this with? And you could unmute yourself and discuss it if you will. No? Oh yeah.
I was waiting to see if Brenda came off mute because she's the one that works primarily directly with the grand families. To my knowledge, we've not shared anything like this with the Logan County group.
Okay. Do you feel they would be comfortable with this? It would be helpful? Do you think it's at their level, so to speak? I mean, something that's, what's your feelings? Gut. I mean, I want to know, we want to know.
Right. Brenda, are you able to come off mute? Francis, I honestly have not, I personally have not met, oh, and I'm frozen.
I can hear you.
Okay.
But
Brenda's,
Brenda,
oh, I'm sorry.
she typed in the chat and said no, they've not shared yet. Were you still frozen?
She looks like she is frozen.
Okay.
All right. Well, anyway, I think that this will be a helpful resource for you all. We will be, adding at least to this to my channel some YouTube videos of these Zoom meetings. And Autumn already has. Autumn, do you want to tell them a couple of the other videos that they might be interested in your channel?
Yes. So I also have a video on resources and advocacy for parents, and it goes over different programs or resource, like I guess collectives. I don't really know how to say that, that they can use, such as the Grand Families program. And I also have included how they can get in touch with their particular representative in their county. Well, I just basically listed like the websites and stuff that they can go to. So if I were to, or if you guys were to share this with the parents, they could have that right there at their fingertips. And it would just be a collective list, so to speak, of a bunch of different advocacy groups. So I think that could help them if they needed any type of help. It would show who they reach out to for what, basically, and what's available in their county and how they can get a hold of them.
Yeah.
Okay, I see that Brenda wrote in the chat, I know 3 families that need help in controlling tempers. Okay. I would love for you guys to tell me any type of videos that you think would be very helpful in sharing with parents, and I could make new presentations. I just was trying to think of things that I knew parents needed or knew that maybe would be hard to access for parents. Um, I had mentioned my other program I'm a part of, Time for K. We have videos on our YouTube channel, which I'll link it to you. Well, I'll link it to all of you. And it goes over different ways that you can use mindfulness activities to try and control different types of usually negative emotions or reactions. And I'll just go ahead and link that in the chat because that could potentially be a resource for you as well. So let me go do that right now.
Yeah, I think that'd be helpful because those YouTube videos are put together by several different graduate assistants and they're very creative. They're all different in their approach to the mindfulness techniques, and they're young people. I think they're good. I think some are even directed towards kids, aren't they, Autumn?
Actually, those are all directed towards kids, but they are made with the intent that parents can use them with their children. And we started making those during COVID because we weren't unable to actually meet with the children. I do have another video that I forgot to mention, and it is actually focused on discipline in the school, and it is restorative discipline rather than your normal punitive, I believe the word is, discipline that we're all used to probably. But that is mainly more or less to be shared with teachers and professionals because they're the ones who can actually enact that in their classrooms. But it would be something maybe for parents to propose to the school that they maybe take on a more restorative discipline approach. But I'm trying to find our Time for K videos. Okay, I found the channel. So I'm gonna go to it and share that whole channel with you guys. because it just features a lot of different videos. It's mindfulness activities, and it can include, I don't know if anybody has done yoga, but it's different things such as stargazing or a body scan or meditation. I've actually done a couple videos for that site as well, but those are mainly just activities rather than presentations, because they're meant to be kind of fun for the kids to be interactive with.
Yeah. And they're not very long, are they, Autumn? They're less than 5 minutes. Is that right?
Yeah, let me see. The longest one I'm seeing here is 6 minutes.
Okay. Yeah. So they're real doable. I think just to share, with parents that they can share with their kids or the caregivers. So, okay. Well, Autumn, I think you do a great job with these videos.
Thank you.
I really appreciate all the work that you've put into it. The one that she talked about, about restorative discipline, she read a book and basically she put all that information in a video, and it runs about how long? It's a longer one, isn't it?
That one's probably 30. No, let me, it's over 30 minutes, I think, but it's under an hour.
Yeah. And it
That
might be,
favorite.
and it's can't hear. Oh, technology. But it's very good. She does a very good job with that. So sorry, Autumn, we can't hear you.
Can you hear me now?
Yes, I can. Yes.
Okay. I feel like I'm in that commercial. Do you know what I'm talking about?
Yes.
Okay. So I'm typing in the chat the book that I read, in case anybody wants to read it, because I thought that it was very good. And I did a presentation with Jenny Anderson. She allowed me to come on the Facebook page that she runs, and it's West Virginia Adventure, I believe. And she allowed me to come on there and give a presentation. I actually could link that as well, probably,
Okay.
because that was recorded.
Yeah, I've seen it. I've watched it. And Jenny Anderson, I hope, is our next guest, which will be in April. And I'm not sure yet the date. We try to strive for the third Wednesday of the month, if that works best for everybody. So, okay. Anything else you want to share, Autumn, before we get ready to wrap up?
I think that I'm good, as long as I've stated multiple times, please give me your feedback. Tell me what you think would be helpful for parents or professionals, or really just anybody that deals with kids. I would really appreciate it, because honestly, making these presentations is that's my favorite thing to do. So.
She does. And she does a very good job.
Thank you.
Yes. All right. Well, the only things that to wrap up for today's meeting, I just want to tell Lincoln and Logan grand families, your toolkit will be delivered next week. I'm going to be sending you out an email and asking you what's a good day for you, for me to come and bring these toolkits. I hope I have everything. I thought I had everything, and then I realized that I liked some of the containers, but hopefully they'll come. If they don't come, you might get some odd container with because I think I was about 3 or 4 short of those or so. But anyway, that is my plan. And I just really appreciate everybody joining in, and it's been a good one. And we hope we can give you some resources that you can use and you can share with others. And if there's not, is anybody else questions before we wrap up? Comments? Nope. Okay, well, start your day well. Happy St. Patrick's Day. And I hope to see you in April. And Autumn, if you'll stay on just for a few minutes, we'll chat. Thank you, everybody.
Thank you guys so much. Might have frozen.
No, you're not frozen. I was just,
Okay.
there's a couple still on here.
Yeah.
So anyway.
Okay.
All right. Well, that went well. And, you know, we're pretty good about punting, aren't we?
Yeah. Thank you for sharing that. I wish that my internet would work.
Yeah, I thought about that yesterday. I thought she freezes up a lot, and I'm gonna and my intent was that I was gonna go ahead and I'm gonna stop this recording right now.